Dr. Zidan, welcome. It's such a pleasure to invite you today to come talk with us about supporting immigrants with a look at Latinos as well as Arab Americans. I've invited you because I know you're an Arab American and you have a lot of lived experience with the population, but just also in your own life. And I'm wondering if you can explain your background to our students and what your research is so that they understand what you bring to our conversation.
Thank you, Dr. Atabi, for having me today. My name is Tariq Zidan. I'm an assistant professor at Indiana University School of Social Work in South Bend campus. And I've been in the United States since 1999, so it's almost like 23 years ago. I've been in the United States. My research is focusing on Islam and disability, as well as Arab Americans and Muslim American dealing with mental health condition as well as disability. So the focus is pretty much on Arab Americans slash Muslim Americans and mental health and well-being, including disability. And I've been, as I said, I graduated from Washington University in St. Louis in 2001, and then I got my doctorate degree from Howard University in 2016. And I'm glad again to be here.
Okay, well, that's fantastic. I'm really glad that you gave us your background because I know that your passion is disabilities, but also you have a fair amount of insight into obviously Arab Americans since you did some very in-depth research about the perspectives on disability for your dissertation. I'm going to start by looking very closely at Latino immigrants who come to the United States and their needs, because we have an evidence-based practice reading that's really useful to kind of frame up the ideas, as well as the fact that Latinos are the largest immigrant group in the United States. So we're looking at this paper by Cecilia Ayon, and she lays out a focus group discussion with a number of immigrants where she explores their needs. And she specifically starts the paper by acknowledging it's the fastest ethnic group in the United States in terms of fastest growing. They represent 16% of the US population, so that's really significant. And almost half of all Mexican individuals are immigrants, and they account for 63% of all immigrants in the United States. Half of these are undocumented, and we know that undocumented status really does affect the experience. And then importantly, it's estimated that 5.5 million children have parents who are undocumented in the United States. So again, being undocumented as a parent really affects your children's well-being and outcomes. So Ayon identifies some problems in terms of difficult experiences transitioning to the United States. And she identifies this in her literature review in the paper. And she talks about substandard housing being a problem, abuse and trauma, stigma in terms of receiving and approaching services, discrimination, and poverty. These are all the kinds of experiences that immigrants, especially Latino immigrants, will report as they try to acculturate and assimilate into the US society. Do you have some experience with this with the populations you've looked at, Dr. Zidan?
Yeah, I think my personal experience as well as the research have shown that there is Arab Americans actually have been suffering and struggling, especially with regard to acculturation, especially when the Arab Americans came from different countries like the 22 Arab League to the United States. They have to deal with the acculturation process. As we know, the acculturation theory based on Perry theory, that the marginalization, then separation and integration, as well as assimilation. So there is also a difference between the Arab Americans, the first generation that they came from other countries in the Middle East to the United States, and those who are born here as a second generation. Like my own kids, for instance, I have 3 kids who were born in the United States, so they are very acculturated and assimilated into the US culture than myself and my wife that we came here. However, we've been living in the United States for over 22 years, but we are assimilated, but I think, and integrated, but I don't think that at the same level that at my children, that they assimilated in the United States because they born here, as I said, the second generation American. And this is, we see this with all different kind of what the needs, as well as the services, and with regard to housing, with jobs, and also the issues of problem mental health. There is a complete different generations with complete different problems.
I see. So we'll talk about that some more, but in your experience, immigrants quite often will have some substandard housing as they settle in the United States. Quite often, maybe more than one household is coming together where people are sharing accommodations because of poverty or lack of housing. So there's a lot of stresses and strains on families that I just want to acknowledge, especially the Latinos. I know living in California, many of them are migrant workers in the farms, and they're really stressed in terms of having appropriate defensible living space. So I just want to bring that up. I know that that's different for different immigrant groups, but I do know the Latinos have really struggled with this, and I think that that is universal for many immigrant groups. We'll talk a little bit more about abusive trauma, stigma, and these other issues too. So social support networks are really critical, and we know that Latinos, as well as other immigrants, frequently have really inadequate personal social support resources in terms of their adaptation because they left people behind in their home countries. And so also some of their social support networks, while they're there, they also may be living in the same conditions of inadequate housing, stigma, discrimination, having backgrounds of trauma and abuse. So their social support network might be there in terms of sheer number of people, but they may be fragmented in terms of the stressors and strains. And we do know that there really are susceptibility issues around the pressures to assimilate and acculturate within social support networks for immigrants. Some people really find there's a lot of pressure to assimilate, while other people find that their social support network wants to create an enclave and really keep people within their network rather than reaching out because of shame, stigma, all the different problems that are going on for immigrants. So 5 major areas needed for Latinos. I think that this is really universal, but Ayon finds this in her study. 5 needs: mental health care, physical health care, education, information and support services, and community efforts. So let's look at each one of these areas. And then Dr. Zidan, you can give us a little bit of insight on each one of these areas potentially for our Arab Americans.
Yeah.
Mental health. So there are some studies, really many studies, that talk about stigma as being a barrier to seeking mental health care. But Ayon's research was interesting because she actually found that in her sample, they talked about the need for mental health services. So I don't know exactly how to really address how we've framed this up as stigma as a barrier versus Ayon's findings, but it's an interesting finding. And she found that the need was also there for prevention efforts as well as counseling for youth as a common concern, because many of the people in her focus group were parents. And they really talked about how they needed a place to be able to send their children for counseling and support, and kind of the idea of a place, a location to go for what they were calling therapy. And it's really important to acknowledge that there are like centers that help people that are like immigrant groups that are oriented specifically to that immigrant group, like Arab American centers or Latino family centers, support centers. And they were talking about in this sample the need to have such resources. What are your thoughts in terms of Arab Americans needing a place to go for counseling?
Yeah, I think I totally agree with Ayon's opinion and also research, because in Arab Americans is a stigma toward seeking help, especially for mental health, is a big barrier for them, because the tradition and the culture that attached to seeking and help to a counselor, going to a counselor or a therapist, or being even like claim that you have a mental health condition, or you're asking for help, because in the Arab culture, mainly like the people who are having a mental health, they call them like a crazy, or they might have the stigma attached to it as like they have a bad blood, or being having a bad genes running in the family. That's why they have kind of like the mental health condition. So and also the families, they try to hide their loved ones that they have mental health, or even ignore them, or even they don't even disclose that they have someone who suffer from depression or even an anxiety, as example, or even autism, like in disability case. So the issue is a big issue in the Arab community. The stigma of seeking help, especially in mental health, is, I can say, is big and attached to the culture of Arab countries that really look down upon that anybody seeking help of mental health. And there is a research been done by Al-Oud in 2012 that indicated that the majority of Arab Americans stigmatize their own people who are have a mental health condition, and they prevent them from seeking help and get access to mental health services in the United States.
Yeah, and Ion doesn't really discuss that in great detail, but I think there are probably some similar kind of challenges for people who've immigrated from traditional societies in terms of how they view their loved ones and their kind of shame and stigma for immigrants coming in from Latin American countries. I think there's probably some similarities, but that's beyond the scope of Ion's paper. So thanks for shedding some more light on that in regards to Arab Americans. I think these are important issues for us to always think about in terms of shame and stigma and how that creates barrier to care. So for example, Ayon found some, qualitative research really gives people to give that rich kind of data or word data around what they're thinking. And then Ayon reports some of the critical quotes. And she says right here, one of the quotes was, "I've always looked for something like support for the children when they become rebellious in adolescence, but I never found it. I would like if there was a place where you could consult a psychologist on certain problems you have with adolescents, or somewhere you could take them so they could talk out what is wrong." So here's an example of probably a mother who's really been challenged by her adolescent, and she recognizes she needs a place to go. And that would be kind of support the idea of having family support centers for immigrants, where you could get kind of one-stop shopping psychologists or social workers or others that are helpers, maybe support groups for mom, some of the other things that you could provide in that kind of setting. Oh, so domestic violence was also a theme, and the need for prevention. So talks on domestic violence, that would be psychosocial education around domestic violence. And so this one person says, "I have friends that talk to me about domestic violence, and they don't know where to go for help." So that whole idea of a place to go for help. And that could also include a support group for women. Mainly women are really needing a support for domestic violence, and creating that mutual aid where people can come together and even speak in their same native language to support each other with mutual aid around family violence. What is your experience with mutual aid and the needs for people to come together and kind of commune together, be connected to each other through language, Dr. Zidan?
Yeah. With regard to this, I see the Arab American community, they get together, especially at the Islamic centers and mosques across the United States. And the mosques and the Islamic centers is not only became as a religious organization, kind of like per se, to provide like rules and talk about Islamic rules and values, but also as a social gathering for Muslims and Arab Americans to go and seek the social interactions and among themselves as a culture. I want to also define between, there is a misconception between the Arabs and the Muslims. Not all Arabs are Muslims and not all Muslims are Arabs. So there is like 40% of Arab Americans are actually non-Muslim, which is Christian, Catholic, or even some of them are Jews. So they go to the synagogue, they go also to the churches, and they participated in these events. When it's come to the also the domestic violence, we see a lot of people are Arab Americans, especially who are the first generation, they get caught in the domestic violence because of the cultural tradition of being like the manpower in the family, that more that they bring all these tradition to the United States, and then they get involved in law enforcement when they hit their spouses, or they even, like, we see this also in the child protection as well. So there is a difference here between, when the people or Arab Americans coming to the United States and bring all these tradition with them, they not really be aware of the United States laws and regulations, especially of like the with regard to domestic violence and child protection. So they get caught in these issues, and they need to. Well, I believe that they need more training and education for the Arab American community about laws and regulations in the United States, especially for the first generation Arab Americans.
Yes, and Ion talks about that, the need for education. So we'll look at that a bit. But I do think that not only do people need education and need to understand their rights underneath the law, and their obligations underneath the law, the immigrants really struggle with that. And I think you did point out that it's important to recognize that there's a lot of stress and strain, especially for the first generations that haven't necessarily acculturated, when they're interfacing with a dominant society that may see women's roles differently. We know that there's a tension for Arab American families. So thanks for bringing that up. And I think that, Ayon's looking at Latinos, and so they do have some of the same similar issues around roles and responsibilities and interfacing with law enforcement, but also the need to get mutual aid, especially for the women who may be experiencing the problem of domestic violence, but also for men who are struggling with their acculturation and maybe have had law enforcement interface. So mutual aid groups can be really important to help people adjust and try to come up with other solutions and strategies rather than violence, in terms of negotiating in the family and really addressing the gender roles and some of the challenges that happen for immigrants from traditional societies.
Yeah.
Okay, so physical health care. I have found that many participants told stories about avoiding health care until the pain was unbearable. This is really for undocumented people mainly, or for people who don't understand health care and they don't know where to go. And so there's some other issues around affordability of health care. And Ayon points out that many of her participants said they really needed comprehensive care, with some of the barriers to access being around not understanding that care, and also the fact that they didn't necessarily have health insurance to cover the care. So there's many challenges around physical health care accessibility. Let's move on from there and look at her third area, which is education. So remember, many of the immigrants, especially Latinos, but also Arab American immigrants, have the need for their students, their children, to receive tutoring, because there's additional challenges around English as a second language, but also the parents not necessarily having either the skill set or the language skills, so the educational background themselves or the language skills to really work with their kids on homework and other challenges. And I think about, English speaking American parents struggle with teaching algebra. Why, an immigrant family would have even greater challenges, probably because maybe they've come from a country where they didn't really get algebra in school. And so there's some really serious issues that go on there with the parents being involved with their children's education and being supportive as we would want. And we're really dedicated to that as social workers, trying to help families really engage and be involved in schools. But there's some real challenges and barriers here. And then also the issues around even getting kids ready for college. So Ayon found that that was a need. How do we even enroll in college? And so first generation families frequently don't even begin to have any experience set in that, and it's really challenges. What are your thoughts about this, helping first generation families really interface with schools more effectively?
Yeah, the first generation, the Arab Americans, that the lack of the fluent in English can have a negative impact on their relationship with even their kids and their also their children education, because they cannot help them in the homework, or even, like, as you mentioned as example, the math mathematics or algebra or other field like science or history because of the language barriers. And also we've seen this a lot in seeking services for the first generation Arab Americans because the lack of the language, lack of education, they miss a lot of opportunity of receiving services or even applying for services if they need because of all these barriers that I'm talking about. So there's always a challenge and a struggle between the first generation and second generation. Even some of the students, the families, the Arab American families, they use their children as interpreters and translators when
Yeah.
they receive a letter in the mail or they want to apply for social services. They need to bring these young students to their meetings and sometimes the doctor's appointments, and they might hear like inappropriate discussion and conversation if they might expose to a lot of issues that they shouldn't be exposed.
Well, and if the child's having problems at school and the teacher's unable to speak to the parents very effectively without the child in the triangulation there as the translator, that creates some really interesting dynamics, especially if the teacher needs to communicate some sensitive information to the parents about the child's needs or the child's behavior. So there's some interesting challenges here around education, but also healthcare. We'll look at healthcare a little bit more closely as we move along. Ayon's participants found that they said we need information on everything. Like we are starting from the beginning, and there's many things that we don't understand. So information and support services are critically important. And again, you can find these community centers where people can go and literally receive very straightforward information in their language, but also guidance and even what I would say is advice giving. Now, in social work, we're really careful about advice giving. We don't want to really get in the way of people's self-determination, but sometimes we have to give advice, especially on issues of immigration, where people are very nervous and they want to understand more and go somewhere that's safe to get information about immigration. So needing advice on in immigration on just about everything, and really being unaware of what's available to them. And it says, this is a quote from Ayon. It says, I think it happens to a lot of us when we come to the country and we are first generation. We don't know our rights and our obligations that we have. A lot of times this happens and we don't know all the things we can do. And even more so when they are about our children as they are growing up. A lot of the rights our children have, we don't know about because as a parent, you don't speak English, you are first generation, and you don't have someone to tell you. So, so this is, I think this is very universal, right, Dr. Zidan? I mean, the United States is very unique in terms of rights and responsibilities. A lot of the people coming in from traditional societies have never had this range of rights around civil liberties, even the right to free speech, to advocate for oneself. And I think that you probably found this even more so with Arab Americans than maybe Latinos. I don't know. I'm kind of putting that out there. As soon as I said that, I'm not sure that that's true. But I think that the Arab world has some real issues around even free speech. So what are your thoughts about this?
Yeah, I think this is, as you said, it's a universal phenomena, but in the Arab countries, more particularly in these countries, that the freedom of speech sometimes is misunderstood and also misinterpreted by many people. But they actually sometimes they cannot differentiate between democracy and freedom of speech, and sometimes they cross the lines, because I think that to be to understand the civil rights and also being like understand about like your rights and be aware of it, it has to be from the young age, as you learn about your rights and how the freedom of speech, and also how you seek help and also be aware about your rights and how you protect your rights. And this for the even more especially for vulnerable population like the person with disability, the mentally ill, women and young children. So there is a lot of misconceptions. And then when the Arab Americans come to Arabs come to America, they actually, even those educated people, with coming with a highly educated background, they still like they struggling to figure out what the right and what the wrong, especially with regard to human rights, because the way that they've been raised in these countries outside the United States is different than being in the second generation here, Arab American, as I said. So it's I think it's all education based on their young age, and the whole dynamic of how they can understand the rights and how they protect their rights is very important.
Yes, I think I'm glad that you touched on human rights because, as you know, social work is a human rights profession. It's really beyond the scope of our discussion today. But, you know, immigrants having an understanding that there's a right to an education, there's a right to housing, there's a right to health care, and then how that actually settles itself out, how that manifests in their lives and their need to advocate for themselves to get better access to care and these other things is really important in terms of rights and responsibilities and dignity and worth of the person, as we talk about in NASW Code of Ethics, but also human dignity in our Human Rights Declaration. As I said, it's beyond the scope of our conversation, but I'm glad that you touched on human rights because they are always critical for us to think about when we're talking about groups of people who are marginalized, groups of people who have experienced oppression, but as they try to seek their human rights, there's a lot of challenges there. So community effect. So this is the last area of Ayon's kind of exploration. And she found that the people that she spoke with in these focus groups identified that they really needed greater community ties to help them participate in society and thinking about even political advocacy, including immigration reform, and changing the negative perceptions of themselves as immigrants. So they recognize that the community is the context of their experience, community is the context of their behavior, of their feeling either safe or not, and that they saw that there was a need to start building community to start to address the negative perceptions and the lack of support in the community. They wanted greater ties, stronger social ties in the community above and beyond their ties with each other. And they recognize the importance to build social support network to create opportunities for mutual support and information sharing. Now, let's talk about Arabs living in the United States. These are Arab Americans. And this is really a slide that you can speak to because you really have a sense of the demographics, especially after your dissertation research. And then I want to, we've talked a little bit about already about your thoughts about hearing for these needs for Latinos. So we can skip that bullet unless you have some other thoughts on that. But then also, the experience, the needs that are similar for Arabs living in the United States. I would love for you to talk a little bit on this third bullet about refugees that are coming into the United States. I know that this isn't your area of expertise, but I think with the amount of Afghanis coming in, and many of them are Muslim, but also we do know that one of the largest resettlement communities in the United States are Arab Americans. So if you could speak to this slide, I would really appreciate that.
Sure. Yeah, let me start with what are the demographic of Arab American or Arabs living in the United States. It is estimated on the U.S. Census that Bureau that about roughly about 2 million Arab American living in the United States. But in the meantime, the Arab American Institute have been corrected the estimate to be roughly 3 million Arab American living in the United States. And you can see there is a difference on the numbers and the data from the census to Arab Americans due to the stigma and also due to some of Arab Americans, they don't want to disclose their identity being Arabs, especially post 9/11. And that is, you can see that there is many of them, they are kind of like they want to hide their identity because the stigma, and also xenophobia, Islamophobia, all these, things that happen post 9/11. When about also talking about the demographics where Arab American living, the majority of Arab American living in the metropolitan areas like Detroit, Chicago, Washington, D.C., Boston, and the big cities, but also some of them are in the small rural areas, small towns. And I can say the Arab the diaspora that been spread all over across the United States, but the majority of them, as I can say, it's in Detroit area, in Dearborn, The focus of there is a large Arab community. There is also a Muslim community as well. With regard to the experience, the need of similar Arab for Arab living in the United States, yeah, I see a lot of parallel needs for the Arab Americans, immigrants and refugees with Latinos, especially, we talked about the need, the upcoming now is a new Afghani after, falling of, the Afghan in the hand of Taliban. And we see a lot of waves of coming and new immigrants and refugees. This is the same happen actually and when invaded the United States went to Iraq and post the Iraq war, and there we have received waves of immigrants from Iraqi refugees to the United States, and also it happened at the civil war in Bosnia. The same happened also in some other countries in Africa, but I can speak especially here in South Bend, Indiana. We have a large number of Iraqi refugees moved to the area, and then they need a lot of services, housing assistance, they need food stamps, they need a lot of services that might not, health care. And the issue is like, because most of them are not a US citizen, so sometimes they are not qualified to receive services from the welfare programs. And in my personal experience, when I was a graduate student in the United States, even without a green card, I had a hard time to receive services from my family, such as food stamps or even housing assistance, because of I'm not a U.S. citizen. I don't hold a green card. I was on an international student visa, so it's kind of like the similar situation. So immigrants and refugees, when they first come to America, they need a lot of services, especially housing assistance. Housing is very important. Language, like need help of provide translation and interpretations, as well as medical health care, mental health, because of the trauma of the wars and all these things that happen in their home countries. In addition to this, they need most important, they need case management. Why case management services? Because they come here to the new land and they have no idea where they can get these services, if they qualify, if not qualify. And we talked about the language barriers, as well as transportation barriers, maybe because they don't know how to drive, or they didn't get a license, or how they get the driver license because they don't speak English as well. So there is a lot of issues here, and I think case management is an excellent services, especially at the beginning for new immigrants and refugees, because they can sort them and help them with how they seek the services. Even if they don't qualify, there is nonprofit organizations, there is like mosques and synagogues and churches. They provide food, they provide assistance for housing and payment and things like that.
So you bring up case management. Again, I wasn't exactly planning on doing a presentation on case management, but can we touch on really briefly the idea of the case manager is the case manager as social worker, helping to link individuals to various service opportunities and helping with a case plan to address these basic issues. So basic needs like how to get a driver's license, how to facilitate that, even how to go through some classes, kind of linking somebody to that, linking people to, as you said, to food opportunities if they're not eligible for food stamps. As you pointed out, that's a major problem for immigrants not being citizens, but where else you can go in terms of the private sector. So linking, so coming up with a case plan. Have you seen effective case management, or even in your own experience when you sought some help as a graduate student on a student visa? Have you seen the interfaces with case management with immigrants that have been really effective in helping people assimilate and really get their feet planted solidly on U.S. soil?
Yeah. I actually, in my own personal experience and also professional experience, when I was living in Virginia in Fairfax, I was working as a case manager for a family services agency, nonprofits, and I was responsible for Arab Americans or Arab immigrants and refugees who came here on asylum visa. And as a case manager, I used to have a lot of resources, like some uh, nonprofit organization. They provide actually cash assistance. So you need to call like on Thursday, particular day, every week, like Thursday early in the morning between 7 o'clock till 9 o'clock, and first come, first serve. So I used to have a list of these organizations, a list of people who need cash assistance. And also there is many nonprofit organizations. They provide health care, like a free clinics for people who are in illegal immigrants, or even undocumented immigrants, or even people on asylum and refugees, because they not qualified for other health care services like Medicaid or Medicare. So I also experienced that working with them, getting free lawyers, free aid, like legal aid clinic that they provide them with help and filing the immigration papers for refugees and immigrants, as well as like women, they get help with, sometimes domestic violence cases, as well as sometimes they need like a WIC, like similar like WIC program, nutrition for their children, as well as like housing assistance and foods. And there is many organization. I think it's a majority of these organizations that help Arab Americans in the United States, especially the refugees and new migrants, are non-for-profits. And they might have sometimes limited funding, but there is still exists in every different states and different areas, and how they target, as well as they help with immigration, like they have, like they call it the citizenship workshops. They help them filing all these papers, translation. They provide also document translations. And I can give you an example for the one in Detroit. It's called Access, which is Arab American Center for Economic and Social Services, which is one of the largest or a nonprofit organizations that's serving Arab Americans in the United States, but mainly in Detroit area and Michigan. But I know there is one in California. It's called Arab American Community Access, ACC. And also I think there is some in, there is only a club, it's called Arab American Club in Monterey Bay. But also I know there is a United States Defense Language Institute that might provide like some help with language and teaching Arabic and, for non-Arabic speaking, but also I think they might help with language as well. So there is services across the United States, but these services are spread all over. And as majority of these services are based on like non-for-profit organizations that provide services for Arab Americans, immigrants, and refugees.
So as a case manager, just really quickly, as a case manager, you would be aware of all these resources and you'd be trying to link people as best as possible with your case plan, making a lot of phone calls, a lot of inquiries, making sure that people get to places when they need to be there, including even the transportation to get there. So it's a complex job in terms of looking at the array of resources and then really literally plugging people in where they need to be. And that's what we call brokering in social work. So thanks for bringing that up. I know that you've done some good work in that area, and it's important for us to think about how we can be case managers with any immigrant group. As you said, Arab Americans in particular have some unique opportunities, but Latinos have some opportunities in their community. And so we just need to be thinking about how we know about this array of resources and how we can link people in effectively. So Elaine Congress gives us a way to think about families in terms of assessment and engagement. And because we've talked about a lot of these areas pretty in detail already, I'm just going to go through these reasonably quickly. And if you have any further thoughts, please jump in. So we have 10 areas for consideration that Elaine Congress gives us in the culturagram. And this is really a way to think about making assessment. Now, she doesn't give absolute questions that you would ask in an assessment interview. She gives you a way to think. about the kinds of cultural overlays that people have in their experiences. And as I said, we've already talked about many of these, but she doesn't actually give you assessment questions. And so I would encourage anybody as we move through these 10 areas to think about what are some of the questions you could ask for assessment of these areas, these cultural areas in the culturagram. So let's look at those 10 areas. She looks at the reasons for the relocation. We've already talked about with Arab Americans, it probably there are some issues around conflict zones coming in as refugees. We know that, as I said, it's one of the largest refugee groups in the United States. You already pointed out, for instance, Iraqi refugees, and again, not to assume that these are Muslims, because there's many Christian Iraqis. I know in San Diego, there's an enclave of Christian Iraqis, for instance. But reason for relocation, Latinos coming in from low resource situations, poverty, there's reasons for relocation that are around finances, around economic opportunity, but also for the people coming in from the south of us, there are communities in which violence is endemic. I know that's true for Central America. And so people are not necessarily relocating as official refugees, but they may be coming looking for asylum. But of course, always the issue around economic opportunity. There's legal status that we need to consider when we're working with people. Are they here documented or undocumented? Those status really does make a difference in how people experience their communities and their sense of trust and safety in that community. And then also, as we're working with people, how long have they actually been in the community? That's time in community. So there's also the language spoken at home and in the community. Health beliefs such as healthcare access and utilization. I think one of the things we talked about a little bit already, Dr. Zidan, is how people actually have varying viewpoints on healthcare. If they haven't had a lot of access in their home countries, one wouldn't necessarily understand the access networks that we have. We also know that they don't typically have very good health insurance, if they have health insurance at all. They are, as you pointed out, the healthcare benefits, the welfare benefits are limited because of their status. So there's just this access and utilization issue we already touched on. There's also impact of trauma and crisis events. And so we know that people come in with varying backgrounds in terms of what they've experienced, negative experiences, and they bring those experiences with them. But also for people who've migrated from Latin America, they very well could have experienced trauma in the process of coming in an undocumented manner, coming across the desert, coming up across really difficult landscapes where they're being taken advantage of. And so we do know that there's trauma, but also crisis events. How does a cultural group even view the crisis event? You know, sometimes people have really strong support systems in their resilience and how they look at crisis and coping. So we need to look at that from a strengths perspective also. We've talked a little bit right now about the contact with cultural, religious institutions, holiday food, clothing. These are all pieces that come together around a sense of support, a sense of contentment with one's kind of viewpoints and beliefs around God and spirituality. These are important ideas, especially as we work with people who are different from us. You've been really educating many of us about Islam a little bit there, not going into detail, but how important it is to understand that people have really important viewpoints that have to be factored in as we work with them. And of course, as you pointed out, with Arab societies, we also have Judaism and Christianity. There are always issues of oppression, discrimination, bias, and racism, and people come from difficult circumstances frequently related to that, and then they quite often land in difficult circumstances in the United States. We know that we have serious systematic oppression in the United States with major problems around discrimination and racism. And some people come into the United States as a majority group person from their countries, and then they find themselves in oppressive conditions, and that's hard for them to adjust to. So that's important to consider. We have varying degrees of values around work and education, the importance of education, for instance. Some immigrants really want their second generation children to receive the education that they never got, while other groups of immigrants might think, well, they just need to go to work. I need my children to earn money as soon as possible. And they may come from societies in which children, like teenagers, are working immediately as soon as they possibly can. And that's really kind of counterproductive as we look at that as Americans frequently, where we have a a value that children should be in school, that they should finish high school. So we can find some challenges, some disagreements in that, and the dominant society, dominant culture in the United States. And then we have values about family, the structure, the power, the myths and rules. When you look at this list of issues here, what are your thoughts, just kind of as a summary, because we really come to basically the end of the presentation now. I'm wondering what your thoughts are in summary about any of these 10 areas.
Yeah, I think all these 10 areas are related to Arab Americans, from reason for relocation until number 10, the values about the family structure, power, and myth and rules. What I can say, one of them are striking me, the number 6, the impact of trauma and crisis event, especially, Arab Americans have been experienced a lot of trauma, because of the Islamophobia, xenophobia, post 9/11, a lot of issues with the depression and anxiety, and as well as like, victim of being, I know that discrimination, oppression, and bias and racism here included, because there is many Arab American has been experienced discrimination in a workplace, in a school settings, and other places. So these are the issues that Arab Americans have faced, and they have to deal with a lot of stigma, a lot of discrimination, oppression, and racism against them based on their cultural identities being Arab or Arab Americans.
Yeah, I really appreciate your insights. I think that it's really interesting to me today is some of the similarities. It's the immigrant experience, whether it's Latino or Arab Americans, that acculturation, adjusting to a dominant society, the United States being a very unique place. People come here, they come to the United States for opportunity. They see a better future for their family, but then they run into all kinds of obstacles that we need to be thinking about how to help. I think one of the things that you brought to the conversation today, which I wasn't expecting, was that overlay of case management. And I really appreciate that. I totally forgot that you had done that work. I know we've talked about it in the past, but just to hear from your experience as a case manager, that was important. And I think that you've really helped us understand the immigration experience a little bit more, and really some of the unique issues that Arab Americans have. I know that I worked and lived in the Arab world for 5 years, and I was an immigrant there. And I know the one thing that I really struggled with at times was some of the family viewpoints on the roles of women. And, I was teaching women, so I could see that they were giving educational opportunities where I was living in the Arab Gulf just outside of Dubai. But there are some real challenges that are going on in terms of family structure and dynamics, especially when the overlay, then they come to the United States. So I think we've kind of touched on that, but do you have any final thoughts about those gender roles? Because I think that's the one thing we could just kind of leave everybody thinking a little bit more about, because gender roles, whether it's for Latino families or Arabs, Americans, are important issues for us to think about as social workers as we navigate those family relationships and help people adjust to a different cultural context.
Yeah, with regard to the gender roles and Arab Americans community, I want to emphasize on one thing. Like, Arab American came from a 22 Arab League, mean like there is a 22 Arab countries that in the North Africa and Asia and the Middle East. So every country has its own culture, and also there are subcultures because people live in a village versus living in a capital. You mentioned Dubai and United Arab Emirates and some other the Gulf countries might have a different culture with regarding to the roles of gender differences between men and women than some other country like Lebanon, for instance, or Jordan, or even Egypt, or Tunisia, or Morocco. So there is a lot of differences within the main culture and for the subculture for each country. And again, it's based on location, education. There's many variations that can decide what kind of rules and regulation, especially with gender rules. But in if I can generalize this or over generalize this, being like in the Arab culture, mainly the man consider be the leader of the house, and in many cases, I cannot generalize as well, being that this is the case in everyone, but mainly there is more for a status, higher status and class for men versus females. The females are considered being like they, as in many Muslim community as well, they wear the hijab. They're not supposed to, go to school or go outside without their relatives and their, husband or brother or siblings. But these are the things are changing now in the Arab countries and also in the Arab community, based on education, based on now the internet, the social media. So the world is becoming a small village now. So the women, that the role of women that being oppressed and being like her voice, the women that their voice that cannot be heard, it been now it's become like really they can actually talk to people on the social media, and then post a video or an Instagram and other media venue. But in the meantime, there is still a challenge for the Arabs that come to America, especially for the traditional culture. And we talked about the culturation and how that Arab bring their own culture, especially first generation. I'm talking about first generation. When they bring their own distinguished culture to America, they kind of like they struggling a lot because they have like their own traditional, old traditional that may be abusive to women, or maybe they think that the men have more power than women, and they struggling when they live in a Western culture like in the United States. And we talk about the culturation process and the changes between the first generation, second generation. But I want to emphasize one thing, my last comments about like how we need to know the social workers, how to deal with the situation when they have working with an Arab client or Arab American client. I think it's very important to look at acculturation process. It's very important to use multiculturalism approach in working with these clients, and more importantly, about getting the skills of culture competency, culture humility, like how you identify your, if you are non-Arab social workers, how you identify your own biases, your own oppression, your own obsession, your own values that might different than the Arab culture, and how you find the middle ground, and also, you know, provide that respect and dignity for someone have a different culture from your own. So I think it's very important to provide training, provide skills for the social workers in general, and more specifically who are non-Arab social workers that they work with Arab clients, to be educated about the Arab culture, the also the role of religion in the culture. Like as we said, the Islam, 60 maybe 60%, roughly 60% of Arabs are Muslims, and the rest are different religion like Christianity and Judaism. So you have to understand the combination between the Islam as a religion for the majority of Arabs, as well as the culture. So there is a two different power here, but you need to understand it as a social worker who are non-Arab social worker or not even Arabic speaking. You need to know about the differences and educate yourself before you're working with Arab clients.
Fantastic. You've really given us a nice overview. It's a complex subject. And people would hear this lecture and they would probably be really interested in engaging in different ideas than the ones we presented, especially when you talk about gender roles. But I agree, we're going through rapid change right now. And with people coming to the United States and assimilating and seeing some different ways of women and how women engage in society, and the importance of a lot of families really need that second income of a woman. And so there's all these pushes and pulls and challenges. So we need to be aware of that as social workers. And I really appreciate that. And overall, I think it's been a really interesting presentation. I know I've learned some things. And I think that Congress, Elaine Congress's culturagram way of thinking around the different aspects of making assessment for how immigrants are settling in and how what their needs are, and then as you said around case management, I think it's a really good way to think about making assessment and working on engaging families in terms of their making adjustment and being really sensitive to their needs. As you said, there's a lot of things to consider about being sensitive, whether they're Latinos or Arabs. So I really appreciate your insights. I think your lived experience is really powerful. So thank you for that.
Well, thank you for having me.
Okay.